So now that we are on LASIK that we were talking about, because I'm also someone amongst that crowd who has been considering about LASIK since very long right now. So where, I've thought about it. I personally also have a very low power, like 0.75 and zero point 0.5. But I have always feared if I can get that surgery. So my next question is on that what do you think people are most afraid of who have been thinking of getting it done but have not got it done yet? And what is something that they need to know even before considering this LASIK surgery?
So, the most restrictive thing that a person can have is fear. Right? Because it's a surgery or it's a procedure after all, and it's a surgery on your body. You are going to be restrictive for that, and it's on your eyes. So, definitely, yes, there is a concern which happens, which is seen generally. And yes, we do see a lot of patients and people coming up to us and saying that I am considered that, but the only thing is it's a surgery. I am skeptical. I am afraid what to do. So yes, see, any procedure which is done on your body will have a part of fear in this. But you need to understand that science, technology, techniques have gone so advanced that there are procedures so safe and so fast recovery that you will hardly know that something has happened to your eyes.
Okay.
Now, the technique of LASIK is so fast that within few seconds or half a minute, the surgery is done. Okay. Now, there is another new procedure which is called as a TRANS PRK or PRK. Now, where we do not touch your cornea at all with the help of any machineries. Okay, no blade, no flap, no cut, no touch. It's an all laser procedure, right? Here, based on the power, the laser time can be anywhere between 10 seconds to just 60 seconds. That's less than a minute per eye, and you just walk in and walk out. Now, coming to the one which was saying as a power, yes. Generally, we see that the power up to 0.5 and below, we generally avoid not to do. But 0.5 or 0.75 and beyond are definitely a procedure at thought. Okay. The lower limit, yes, 0.5 or 0.75 can be done. Upper limit can be anything. Based on the cornea, the black part of the eye, that's called as cornea. Now, based on the curvature, the thickness, the power, when we do the pre-LASIK evaluation, we come to know whether you're suitable for the procedure or not. And if yes, which kind of procedure you're suitable for. The laser procedure or the lens-based procedure.
Ah, okay. Because I think I also heard, maybe it's a myth now that I'm hearing from you. I was told that people who have 2.5 and above as a power are the ones who are eligible to get this, LASIK surgery. But I'm so glad to be hearing this. So because you mentioned a lot of procedures in between, so maybe if you can walk us through the complete experience, right from, say, booking a consultation at Solanki Hospital, say, for LASIK surgery, to the day when we walk out without glasses. So if you can walk us through, please.
So when you take an appointment and visit us, so we will first have a complete examination of both your eyes. Right? We will first do a pressure check in your eyes. We will check the power of your eyes. We will check how the nerve inside is. We'll put the drops and examine you. Before that also, when we give you a small information what the procedure is about, or what your expectations are, what will the actual outcomes of the procedures, because your alignment with your understanding is required. So we do a pre-LASIK evaluation. So in that, what we do is we do the corneal topography. Now this is a test to see the curvature and the thickness of the cornea. In other words, it's mapping out, okay, the cornea, whether you're eligible or not. We also do something called as a dry eye evaluation. Now there is a thin layer of tears or water on the eye, which is called as a tear film.
Okay.
Now, is this healthy enough or not? So, based on that, these two tests and the power of your eye, we see whether you're eligible or not. So, the three basic criteria that we see here is age beyond 18 to 20. Second, power to be stable for 6 months to 1 year. Third, the test which I just told, the topography and the dry eye evaluation to see your stability and the thickness of the cornea. So these three tests will be done and told to you whether you're eligible or not. And based on that, we give you the options, either LASIK or PRK or ICL. Now coming to the LASIK part, your appointment is fixed. On the day of the surgery, you just walk in, okay, and we will do a pre-evaluation again to see your power of the eye, and then you are in the OT. The walk-in of the OT is just about 2 minutes. Okay, you come in, we just cleanse the eye with a solution. We put an anesthetic on the eye to numb the eye. Of course, eye being the most sensitive part of your body, you will not. No one lets us touch the eye, so we put the anesthetic drops in the eye, and then the laser is done. Now, in procedures like PRK or TRANS PRK or TPRK, the laser is fired, and within few seconds, maybe 10 seconds or 20 or 30 seconds based on the power, the surgery is done. And then you walk out. So on an average, it takes about 30 to 50 seconds per eye, and in and out of the OT, a person can expect between 3 to 5 minutes. Now, you walk into the OT, you walk out of the OT. And after half an hour or 45 minutes, after the medications are instilled in your eye as an antibiotic, there will be some painkillers which will be given, and we'll be explaining you the do's and don'ts. And then you walk out. And next day, you're almost clear.
Oh,
So the whole,
that sounds pretty
so the whole time, if you're in your hospital during the day of the surgery, might not be more than 1.5 to 2 hours.
impressive. So, because I only knew about LASIK, right? You also spoke about PRK and TPRK. If you may, in layman's language, where my audience can understand, what exactly, how are they different?
So LASIK is a procedure where you make a cut in the cornea. Okay. Cornea is the black part of the eye, which is the first structure of the eye. So you make a cut, you raise the flap, put the laser on, treat your power, and close the flap. So that's the procedure for LASIK. In PRK or TRANS PRK, the skin of the cornea is removed either manually or through the laser itself, and the laser is fired immediately. So in the LASIK, you are lifting the flap and closing the flap. In the PRK, you're not doing anything. You're just putting directly the laser on, and the laser does everything. That's why we say this is a no-touch technique. In everything else, you are touching the cornea with an instrument, with a blade or with another laser. Whereas here, you're not doing anything. So that's why the surgical time in these procedures is the least of all the laser available.
Okay, interesting. So then, if I were to ask you from a little finance angle, because I've heard a lot of people also say who have considered this, that, LASIK surgeries are usually a little expensive. So if you can throw some light, what is it like when it comes to financials for people who are considering this?
See, these are cosmetic procedures, right? So based on the power we do, and yes, these are laser which are advanced. So yeah, the cost is a factor here, being in this geography. But then the outcomes and the longevity is the longest. It's high. So for example, let me run through this. If a person is wearing glasses, and on an average, if he changes glasses every 1 to 1.5 years or maximum 2 years, the cost of the glasses with the frame might be anywhere between 5,000 or 7,000 on an average, right? Now, when you're on the screen for long term, then you need to have anti-glare coating and anti-fogging and all dusting and all. So that can go up to 10,000 or so. So every year or every 2 years, if you're changing, this multiplies.
Correct.
Right? And if you're wearing glasses when you're going outside for your picnic or vacation, you would want to wear goggles, right? So you make powered goggles also. Now that again becomes costlier.
Cost, right?
Okay. Or if you're going for some function or events, then you don't want to wear glasses, then you wear contact lenses. So when you put this, there are recurring costs which comes. Now all this cost can be just put in one thing, one cost, and the surgery is done. The cost of the surgery can vary from place to place, but in ours it's about 55,000 for both eyes, and that's one time permanent. So if you're getting it done at around 20 or 22 years of age, for the next 50-60 years you don't have to think anything about it. So yes, it is a one time cost, but then the effect of that stays for long. Okay. Now procedures like PRKs, other places could be very high, but in ours it's quite low. There are specific procedures like Smile and Silk. Now, these are quite costly because the machinery is costly. That's why they can go anywhere beyond 1.25 or even 1.5 lakhs. Whereas this is just 1/3 of it. And the effect of this is the same. So the cost, yes, initially when you hear it might be a bit factor, but then you multiply it to your daily usage. This is a minuscule of a number for a long term.
Definitely. So then, all of these surgeries are covered in insurance. People who have it, like, how does the insurance policy really work in this?
So as I told you, my first statement initially was these are cosmetic procedures.
Right.
Now, insurance will not cover this as a cosmetic
Okay.
procedure. So generally, no, it doesn't cover. But yes, if the powers are quite high, and if your insurance policy has been informed that, or your says that it is eligible, okay, or covered, then yes, it is there. But then that has to be verified with your policy. There is nothing that we can do in it. If the policy says the procedure is covered with this power or X power, then it will be covered. Otherwise, no.
Okay, perfect. So, again, out of curiosity, what is the success rate for those who have got this LASIK surgery or TPRK
So
surgeries?
we have been doing from more than 18 years, and I have personally been doing more than 10 to 12 years of these lasers and PRKs. The success rate, what I have seen in my cases, have been more than 99 to 99.5%.
Wow.
Now, this is one of the highest what we have seen. Yes, I can say it is more than around 99.9 also, but then I'll be very realistic because expectation has to meet the reality and natural. So, this 0.5% are the complications or no, nothing of those. No one has had any major complications or any issues. It's just a delay, that's it. So in that way, has anyone come back to me saying that my powers have come back, I'm not happy with the outcomes, or there is any other complications? Till now, no. So that's what my track record is.
Very impressive. I think then I'm soon going to see you for my pre-evaluation of the surgery then.
Glad to have you there.
So,